When a patient comes in the office and says, my nose is blocked, I can't breathe through my nose, what goes through your mind?
So it's interesting. I think people sometimes have trouble with the language associated with nasal obstruction. So a lot of times people come in and they tell me, I have a sinus problem. I've had bad sinuses for years. It's a very common complaint to us. And so the first thing that I want to do when somebody comes in with sinus problems is differentiate. Are they truly having chronic sinusitis, which is not really what we're talking about today, but that's where you have recurrent infection, you're needing antibiotics, you have pain in your face, pain in your eyes, drainage. Those people probably benefit from some kind of therapy for infection, whether it be antibiotics or eventually some sort of a sinus surgery. That's what I want to differentiate between that and somebody that truly just has nasal obstruction. They can't breathe out of their nose. They say, I fall asleep at night and my mouth gapes open. I'm breathing through my mouth all the time and I'm just frustrated because I'm tired of not being able to breathe through my nose.
Is it usually one-sided obstruction, or is it usually both at the same time, or everybody's different?
Everybody's different, but it's one of the first things that I'm thinking of when I see a patient. I want to know the answer to that question. Some people will say, hey, I got hit in the nose with a softball when I was 15, and ever since then I can't breathe through the left side of my nose at all. That patient is probably going to need a different treatment than the patient that tells me during the day I can breathe just fine, and then at night when I lay to the left I can't breathe on the right. When I lay on the right I can't breathe through the left. So those patients probably have a different type of problem, and it's important to distinguish between those two kind of right off the bat when we're thinking about nasal airway obstruction.
So do you think about it by taking the history, or history plus physical? What do you find when you look at the nose when somebody's got one of those histories?
So they're both important. I want to make sure that I have a pretty good idea of what's going on before we start looking, because sometimes we might want to do something like a CT scan to look for sinusitis. Sometimes we won't need to do that. Most of the time with somebody that can't breathe through their nose, it's something that we can figure out with the history, knowing do they have allergies, are you sneezing a lot, are your eyes itching? That's one group. Are you somebody that's had a nasal trauma? That's a separate group. So the history is really, really important when we're building our foundation of what might be causing this obstruction, and then looking in the nose after that.
When somebody's talking with you, do you automatically start looking at their nose and looking at their eyes? What tip-offs do you see of somebody that's got nasal obstruction?
Sure. So there are some things, particularly in kids or people that have had nasal obstruction since development, sometimes we can see differences in the face shape because chronic mouth breathing is not the way that our bodies like to breathe. And so there's some changes that take place. But primarily, this is kind of a hidden problem, which is one of the unique things about it. So when I see somebody, they may have the worst deviated septum in the world, but you don't know at all just by looking at them. And same thing with the turbinates. Those are structures that are all pretty well encased in our nose. And so when you look in and you're kind of looking at them in the clinic, you can't see a lot most of the time.